Hello and welcome to my video blog, and today on A.Vogel Talks Menopause I'm going to be talking about dry mouth and how to help yourself in the menopause. Now if you like this video and want to be notified of new ones coming out each week, then please click on the subscribe button below or at the end of the video. Is dry mouth a symptom of the menopause? Yes, it can be. It's one of these surprising ones that very often isn't linked to the menopause, but a lot of women are finding that they're getting symptoms associated with a dry mouth. On the whole, it's caused by the hormonal changes. The mouth is one of our mucous membranes in the body, like the vagina, like the digestive tract, the bladder and the lungs and the eyes. These are what's called mucous membranes, and they can start to dry out in the menopause because of low estrogen levels. It can also affect the gums. Some women find that their gums will start to bleed much more easily. You can get receding gums. And other women find that it can affect their tongue. So between all of these, they can cause some really uncomfortable symptoms during the menopause that can sometimes be difficult to resolve. So what can happen here? The symptoms would be things like a burning mouth. So you might find that your mouth just feels like it's on fire the whole time, regardless of what you do. You might find that you've got a dry, sore and sticky mouth just in general. You might find that you have increased thirst because of this. Some women find that they get sores or cracked lips or very dry lips. You can get a dry, sore tongue. You might find that you're having problems speaking. You want to go and say something and you find that your tongue just basically sticks to the roof of your mouth. You might find that you're having difficulty tasting, chewing food, or even swallowing. You might find that you've got some bad breath. And of course, all of this can have a risk of things like tooth decay and receding gums too. So this is quite a big picture. So most women who have this will have a combination of some of these particular symptoms. So how can you help with this? Well, guess what number one is? Loads of water. Mucous membranes need a lot of water in order to stay mucousy and moist. So this is the number one treatment. Get lots of water into you on a daily basis. You can look at increasing water-filled vegetables in your diet. So that would be lots of sort of salady vegetables, your fruits. These can all help to increase the amount of water that you're taking into your daily diet. You can look at ginger. Ginger is a lovely herb for stimulating saliva. So some people find that just chewing a little bit of root ginger can be very beneficial, or having a couple of cups of ginger tea on a daily basis can help as well. Try not to go, if you're chewing ginger regularly, try not to go for the preserved ginger, because that tends to be wrapped up in a lot of sugar or syrup, and obviously that's not going to be particularly good for you as well. Check with your dentist. A dry mouth can be due to blocked salivary ducts. That can be very specific reasons for this. So one of the first port of calls to go to if you're getting a dry mouth is just to go and see your dentist. See Buckthorn Oil. This is a fabulous remedy for all dryness in the menopause, and it can work really well for a dry mouth. If this is happening as your periods are starting to tail off or they've stopped, you could look at our menopause support, because this can help to just very gently raise and balance your estrogen levels. You need to avoid certain things, and it tends to be the ones that we enjoy. So things like caffeine, your high salt and sugar foods, alcohol and spicy foods, these can all affect the mouth quite a lot. So it's probably best to avoid these until you find that you're getting some improvement with the mouth as well. Avoid dry foods, because again, if you have a dry mouth, you're not producing a lot of saliva, and these dry foods like crackers and bread and pasta can all make it much more difficult. And then if you get sort of a really dry mouth, you can then find it difficult to swallow. And if you keep doing that, you can actually end up irritating the throat, so you then end up with a sore throat too. You could look at medications. Some medications can cause a dry mouth. So if you find that you've recently started something that you've been prescribed, then just check the patient information leaflet here too. Mouthwashes, most of them contain alcohol, and that can make a dry mouth worse. So if you use a mouthwash on a regular basis, then maybe check with your local health food shop to see if they do alcohol-free ones. And alongside that is toothpaste. The majority of toothpaste that you get contain loads of chemicals, things like sodium lauryl sulfate. They can contain things like triclosan and all sorts of other things too. So they can affect the mouth and the gums. So in this situation, going for natural toothpaste without any of the nasty chemicals in them can make a real difference here. Now, just two other things to be aware of. If you are getting a dry mouth and your eyes are getting dry as well, this could be something called Sjogren syndrome, and I can never pronounce that properly. If this is the case, if it's a combination of dry mouth and dry eyes, this is an autoimmune condition, so just get this checked out by your doctor first before you start any of these remedies, because it's best to get a proper diagnosis in this case. The other thing that can happen is that if the amount of saliva in your mouth is reduced, this can have a big impact on your stomach digestion, and you might find that the dry mouth ends up being linked with indigestion, burping, wind, gastric reflux. If this is the case, we have a super remedy called Symptom, which is a bitter. So bitters can be really helpful for stimulating stomach digestion. So it could be a good idea to add this one in as well if you're getting a combination of dry mouth and things like indigestion. One of the things that I am asked on a regular basis is, does this go away after the menopause? This is one of these questions that I can't answer. For some women, once their estrogen starts to balance and the body is feeling better, then the symptoms will go away. For other women, it might remain. But the thing here is, the more you do to try and resolve this as soon as it happens, then the less likely it's going to continue for right through the menopause and afterwards. So I hope you found this one interesting. As I say, it doesn't seem to be a particularly well-known menopause symptom, but we do know that a lot of women can suffer from this in some way. So I look forward to seeing you next week for another edition of A.Vogel Talks Menopause.